ABC 10 News at 7 starts now.
Local restaurants with outdoor patios are trying to lure San Diegans out for Super Bowl Sunday, even as health officials urge people to stay home. Good evening. I'm Kimberly Hunt.
And I'm Steve Atkinson. Our ABC 10 News reporter Anthony Pura is live at the gas lamp where the county says it plans to increase enforcement tonight. Anthony.
That's right, and county officials are concerned about people going into large gatherings for Super Bowl Sunday. Now, I can tell you that they are telling people to go ahead and stay home, watch the game from home with their immediate households. But of course, people will want to go out for the big game. At least that's what restaurants are expecting. We spoke with people here at Barley Mash. You can see they've adjusted their restaurant to meet COVID-19 guidelines. Outdoors only, dividers between the tables. And as for Super Bowl Sunday, it's first come, first serve here, and the challenge will be limiting crowds. They're asking people come in smaller groups. Social distancing rules are also going to be in place. But with that said, they know people want to have a good time. They want to enjoy the game. So it's a balancing act between that and keeping people safe.
Since we're only able to do outside, we built some wonderful parklets. We have social distancing. We're putting TVs up. We have all the indoor TVs pointed outside. We're going to blast, music. We're going to have just speakers outside, just to get that vibe.
Now, San Diego police say they will be increasing enforcement on Super Bowl Sunday, responding to businesses that may not be following the rules, although they said overall businesses have done a pretty good job during the pandemic. And as far as residential gatherings, they will be relying on noise complaints to find out about those gatherings, in which case they will also be prepared to respond to those as well. We're reporting live tonight. Anthony Pura, ABC 10 News.
Anthony, thank you. And some sad news tonight. For the first time, a local child has passed away from COVID-19. The county says the 10-year-old boy did have underlying medical conditions. He is one of 39 new COVID-related deaths in the county. There were also another 1,400 coronavirus cases today, but our test positivity rate remained low at 6%.
Just days after students return to the classroom, there is already an outbreak in the Escondido Union School District. Today, the district announced COVID cases at 4 schools have forced 81 students and 15 staff into quarantine. The schools involved are Far Avenue Elementary, Pioneer Elementary, Mission Middle School, and Rock Springs Elementary. The district says none of the COVID cases was contracted at school. With COVID-19 vaccines still in short supply, there is growing debate about who should get them next. As ABC 10 News reporter Adam Rakusin explains, there is one idea on the table that would open things up to a very large age range of people.
For the past 11 months, Lauren Gillihan and her husband have been locked down in their La Mesa home. Like most everyone else, they've been trying to avoid getting sick. Both Lauren and her husband have underlying medical conditions upping their risk.
I have lupus, and my doctor pretty much told me it would be devastating for me.
So when the vaccine rollout began, Lauren was pretty excited until she found out she's not near the top of the list. See, she's 64, and that's not in phase 1A or 1B. With medical conditions that put them at a higher risk, she doesn't understand why it could be months before it's their turn.
I really thought that we would be in the 65 and over tier.
That could change.
And we really want to get this right.
On Wednesday, the state's Community Vaccine Advisory Committee put up this slide, recommending a slight change to the current schedule. This recommendation calls for people between the ages of 16 to 64 with underlying serious medical conditions or disabilities that increase their risk of developing severe COVID-19 to go next. It would only apply to settings such as health systems or other clinics because you would need to prove you're eligible. What would be the qualifications? Who would sign off? How would it work? And what next means? That's a longer conversation happening now with a smaller group.
We'll begin our work at the end of this week and address recommendations and advice.
We have to establish the goal first, and then within that, we have to try to gather as much good evidence as we can regarding risk factors.
Aaron Cariotti is the director of the medical ethics program at the University of California, Irvine. He says you'll probably see guidelines from the state continue to evolve.
I never thought I would wish to be older, but...
Adam Rakusin, ABC 10 News.
The county says it continues to monitor discussions and remains poised to move ahead when the vaccine supply allows it. A state committee of health experts met late today to discuss changing the vaccine priority categories. We'll let you know if they decide anything.
President Biden is deploying the military to help speed up vaccinations. The Pentagon announced today it will deploy more than 1,100 troops to 5 vaccination centers, including one in Los Angeles. The center at Cal State LA will open by February 15th. The president has called for setting up 100 mass vaccination centers all around the country within a month. And as more seniors across San Diego County are lining up to get the COVID-19 vaccine, others are stuck in their homes with no way to get to a vaccination site or a doctor's office. Our ABC 10 News reporter Mimi Alcala takes an in-depth look at the help on the way for them.
I'm very concerned about access for these folks.
Many seniors across San Diego County are stuck at home, and for some, leaving at all is not an option. This is creating problems for those who need to get a COVID-19 vaccine.
We know where these folks are, so we're going out to about 4,000 people every single day.
Paul Downey is the CEO of Serving Seniors, a nonprofit that helps with housing needs, health and social services, and home-delivered meals to low-income seniors countywide. He says case managers have been hearing from many who either can't book an appointment for a vaccine because they don't have access to a computer or a smartphone, or just can't leave their home to get a shot.
We're getting hundreds of calls a day from panicky seniors who are saying, help me get a vaccine. And so we're doing our best, but the resource we have is going to the county website like everybody else trying to get a vaccine and trying to get them scheduled.
He wants to make sure homebound seniors are not forgotten during this vaccine rollout process. Right now, the county is working on vaccinating those living in long-term care facilities.
We've done, I think, close to 1,000 now, and the rest are scheduled.
But County Supervisor Nathan Fletcher says more help is on the way.
We are going to then begin and shift and go to seniors who we know we regularly provide service to who are homebound. So we have a list of a lot of those folks. And seniors that are homebound or disabled can call 211 and register and get on a list to be a part of that program as well.
Starting Monday, Fletcher says homebound seniors who call 211 will be put on a list and someone will follow up with them. The county still only has a limited supply of vaccines right now, but once more are available, those seniors will receive a home visit to get a shot, and someone will wait with them for the 15-minute time period after.
We have one provider who will do it, and then we'll most likely also utilize our firefighter teams that are out doing a lot of those long-term care facilities now. We'll just continue that same work in taking care of folks in their homes. Now, it is going to be a little bit slow because it's obviously not as efficient.
The logistics are still being worked out, and it will likely be a lengthy process to get to all of the homes. But Downey says he hopes to collaborate with the county on solving this problem to make sure no seniors are left behind.
We have a pretty good idea of how to reach significant numbers of homebound seniors. We do feel we can be a resource to the county, and hopefully we'll be able to work more closely with them.
Mimi Alcala, ABC 10 News.
And next week, we will take an in-depth look at some of the alternative options when it comes to receiving a vaccine. And we also know there are a lot of questions and different experiences with the vaccine rollout. Our ABC 10 News in-depth team is committed to tracking down the answers and sharing your stories. Just send us an email to tips@10news.com.
Police need your help finding a man they say grabbed and rubbed up against women in public. Investigators say this man entered 2 City Heights businesses January 21st on University Avenue and inappropriately touched 2 women. They say he spoke English and Spanish and had an unusual gait. If you recognize him, you're asked to call San Diego Police. Family and friends of a missing Chula Vista woman are teaming up with police to find answers. Today, they held a joint news conference begging for information about where Maya Miliete may be.
Please bring her home. We need our sister. Her kids, they need their mom. Please help us find my sister.
Friends and family also filled the streets outside the Chula Vista Police Department asking people to honk for support. Maya Miliete was last seen January 7th. Her husband Larry says they had a fight and she left. Police say Larry is no longer cooperating with them, but they have not yet announced any suspects.
2 women who claim San Diego police showed favoritism during a protest in Pacific Beach are suing the city, the mayor, and the police chief. Pro and anti-Donald Trump activists got into a confrontation January 9th. The lawsuit claims that police only declared an unlawful assembly for the anti-Trump crowd, and officers used excessive force. Police claim it was only the anti-Trump protesters who threw objects at them. Neither police nor the city are commenting on this suit.